Welcome to the Episodes and Encounters section in MasterCare Plus. This part of the system helps you manage the full journey of a client's engagement with your service, from initial setup, through ongoing care, to discharge. An episode represents a defined period of care, which may relate to a referral, a treatment plan, or participation in a specific program. Within that episode, you can document multiple encounters, each representing an individual appointment, session, or contact with the client. You can also apply tags to episodes, which makes searching and filtering easier, especially when managing large volumes of client records. To create a new episode, click Add Episode. At the top, you can set the status as either planned or in progress. Use planned when preparing an episode in advance, and in progress once care has begun. From there, you'll enter key details including the program the episode belongs to, the setting and location of service delivery, and assign a responsible provider. You'll also input the start date and time and, if known, add a planned duration or end date. The reason field allows you to provide a short explanation of why the episode is being created. In the Documents section, you can attach relevant files by uploading them from your computer or selecting from clinical documents already stored in the system. This is helpful for keeping background documentation linked to a client's episode. Further down, the Service Items search bar allows you to start preparing billing items associated with the care provided in that episode. Once the episode is saved, you can begin recording encounters. Each encounter logs a single interaction with the client, whether it's a face-to-face session, telehealth appointment, or phone call. Within each encounter, there's space to capture detailed clinical information. Use the filters to quickly search for an episode or an encounter, or sort them with the tags. You can add the care team members involved, and enter notes on the right-hand side of the screen to record observations or session details. You can also attach clinical documents, such as assessments, case notes, or outcome measures. These can be created using built-in templates. Or pulled from your shared library. If needed, you can add a clinical summary to capture the overall outcome or key themes from the encounter. Additional fields allow you to document diagnoses, procedures, and link them together. You can upload or reference imaging and pathology results. And list current and ceased medications. Further down are sections to record any recommendations. And add the provided client resources. Follow-up appointments can also be scheduled directly from within the encounter, along with the discharge details. Each encounter includes the ability to log service items, which feed directly into your billing workflow. This streamlines invoicing and ensures clinical activity is aligned with funding or reporting requirements. It also reduces the risk of duplication or missed claims. The entire Episodes and Encounters section is designed to be flexible. Whether you are supporting long-term mental health programs, chronic disease management, or short episodic care, this module can be adapted to suit your workflow. You can customize which fields are visible, and your team can adjust the layout to suit their needs. All documentation includes version control, allowing you to track updates to clinical records over time, supporting quality, audit, and compliance requirements. Together, the Episodes and Encounters module in MasterCare Plus offers a complete, structured and auditable way to manage client care. From clinical notes and medications to billing and discharge planning, everything is captured in one place. Thanks for watching. For more guidance on related modules, check out our other videos covering clinical documentation, outcome measures, billing and reporting in MasterCare Plus.